The World Kidney Day is a day when we try to take note of our kidneys and think about the work that our kidneys do and think about the things that we can do to make the kidneys work better, and also to appreciate those who look after kidneys and those who suffer from kidney disease. The kidneys do a lot of work in the body, and when the kidneys are sick, we call it the silent killer, because patients eventually pass away and only present with symptoms when the kidney disease is advanced. So most patients' symptoms will include things like feet swelling, or having headaches because you have very high blood pressure, or even things as small as having low appetite and feeling fatigued, things that most people tend to ignore. So things like this might be a sign that your kidneys are not well. So our theme is, are your kidneys okay? Do you know if your kidneys are working well? Do you know if you have 2 kidneys? You may actually have 1 kidney. Every time you go to the toilet to pass urine, remember that that is your kidneys working, and look at the urine you're passing. See if the urine is looking like a healthy urine or a non-healthy urine. Healthy urine is urine that looks like water, urine that does not have any froth on it. That is healthy urine. If your urine looks like water, you're doing very well and you're passing good urine. If your urine doesn't look like water, any other color, maybe you need to make sure that you check your kidneys. In this particular season of so much heat, it's really important that we keep rehydrated. Rehydrated means that you drink a lot of water. A lot of water for a person depends on if they are active outside, always in the sun and always sweating. They may need to drink a little bit more than someone who sits in the office and does not sweat as much. When you sweat a lot, you lose a lot of water and you need to drink more water. When you don't sweat as much, you may need to drink less water. But also, if you are diabetic, if you are hypertensive, talk to your doctor, ask him if the drugs that you're taking are affecting your kidneys. Even when you buy drugs from over the counter, check and see if those drugs are bad for your kidneys, or if they're going to interact or interfere with the other ones that you're taking and cause harm to your kidneys. Other things that you may not think about is supplements. Some supplements can end up being harmful to the kidneys. So even the supplements, which may seem harmless, because the kidney does a lot of work in getting all these things out of the blood, may end up being harmful. Whenever you have an infection, say you have malaria, say you have a bout of diarrhea and vomiting, those are episodes of having injury to the kidney. So also check the kidney function and see. Sometimes your kidneys may be okay, but if you have repeat infections, it ends up causing cumulative harm to the kidney. So checking out your kidneys after such episodes is really important. We'll also be having patient checkups for anybody who's walking in to see if there is any risk factors you may have for the kidneys. And you may also be able to see a doctor in case something comes up that is showing that your kidneys might not be working well. So please feel free to come by during the course of the day, which will be on the 13th and 14th of March. The Uganda Kidney Foundation is going to be holding a World Kidney Day Celebration Conference, which will be on the 13th and 14th of March at Kawira Country Club. And we invite the general public to come and attend and be part of this occasion. It is going to involve a lot of keynote speakers. It's going to involve the Ministry of Health, and it's going to involve everyone, patients and specialists involved in kidney care.